You're listening to The Money Hour with your host, Tina Mitchell, on Alternative Talk, AM 1150. Now, back to the show with local mortgage and finance expert, Tina Mitchell.
Welcome back to The Money Hour with your host and mortgage expert, Tina Mitchell, right here at 1150 AM KKNW, the Saturday, September 2nd show, bringing in expert advice and inside knowledge on today's events in our local economy and how they can affect your money. If you're hearing my show at a different time or day, you are listening to a rebroadcast. You can call the show at 1-855-400-1150. Again, that's 1-855-400-1150 or online at themoneyhour.com. And in studio, another first-time guest in studio is Dawn Desonier, transitions in Dementia Care. And we're going to talk a little bit about Dementia Care and Alzheimer journey and pronouncing Alzheimer correctly.
Doing a good job of that.
Okay, good. So, Dawn, thank you so much for joining me first time in studio.
Well,
Happy to have a conversation with you.
Thank you, Tina. I'm glad to be here.
And a little bit about Dawn. Dawn provides individual coaching along with family facilitating and meditation services to caregivers and families of loved ones with Alzheimer's disease and related dementias. His journey to this professional calling is rooted in having been a caregiver to his wife, Nancy, who was diagnosed with early-onset dementia in 2008, passed away from this illness in 2012. Dawn has a certified in Gerontology from University of Washington professional and continued education program. He also has a Juris Doctor degree and has been trained as elder and adult family mediator. So we're going to be talking about a person-centered dementia care and Alzheimer journey. And I'd like to just start out with, what is the difference between Alzheimer's disease and dementia?
Okay, it's a good question, Tina. I just wanted to begin to lay some foundation with some statistics from the recent Alzheimer's Association 2017 stats. Alzheimer's disease is the sixth leading cause of death in the United States, with more than 4 million Americans right now living with the disease. And by 2050, that number could go to 16 million. Of note is that 10% of those individuals who are 65 and older have Alzheimer's. So the question about the difference between Alzheimer's disease and dementia is a very good one because people are confused. Do you have Alzheimer's or do you have dementia? What does that mean exactly? Well, dementia, as that term is used, is an umbrella term of sorts to describe a set of symptoms associated with cognitive decline, such as memory loss or other indicators that daily functioning and memory have been compromised. So examples of those kinds of symptoms would be challenges around eating, bathing, toileting, and so forth, which are the so-called activities of daily living, or sometimes you hear them described as ADLs. There could also be difficulties with meal preparation, finances, driving, or shopping, the so-called instrumental activities of daily living. Now, 60 to 80% of people with dementia have Alzheimer's, so it is the most dominant disease where dementia symptoms are existent. A few examples of other types of dementia-related illnesses include vascular dementia, which I believe was Nancy's primary dementia. Dementia with Lewy bodies. My mother-in-law died of that illness. Frontotemporal dementia and Parkinson's-related dementia. All these diseases are irreversible and there is no cure. It's also worth noting that there are other forms of dementia that are the result of diseases or conditions which mimic dementia symptoms but could be treated and reversed, like dementia symptoms related to depression or delirium or medicinal side effects, thyroid problems, vitamin deficiencies, or excessive alcohol use.
So thank you for clarifying the difference between the two. And yeah, my mother-in-law has both, and I was just going to ask you, is it common that that they have both? And so early stages, but it's a diagnosis that's devastating to get that. So does there exist a common myth or a potential misunderstanding concerning the caring for or engagement with someone with Alzheimer's disease or related dementia? There
is, actually. Often people think that simply by virtue of a diagnosis of cognitive impairment or dementia, a person with Alzheimer's disease or a related dementia is no longer viable or functional or important or has anything to offer or can make decisions for themselves. In short, with a diagnosis of dementia, sometimes people think that this person is now somehow automatically less than.
Yeah, which is definitely not the case.
No.
And a lot of times when it's early, they can be fine and have clear memory almost for many years, right?
Well, that's exactly right. And be very functional and active and engaged.
Yes. So how could this misunderstanding impact one's perspective of a person with dementia, and in turn, how care might be provided, Dawn?
Okay. Alzheimer's disease and many, if not most, related dementias are irreversible. Mm-hmm. There is no cure. So the person living with dementia gradually loses their ability to converse, perform normal activities of daily living like I talked about earlier, recognize others, and so forth. There was a time when my wife no longer knew, that I was her husband, although I know she thought of me as a trusted friend. So understandably, there's a tendency with a diagnosis of dementia to look at an individual with dementia as being less than as a result of their illness. In fact, it would be easy to simply look at the dementia caring journey or dementia caregiving journey as simply a death march, and to perceive that the life of their loved one no longer has any inherent meaning and is now on a downward and hopeless spiral. The main care goals might then be simply to treat, stabilize, and maintain that person's health, and to focus simply on maintenance of the disease. And so with all of that, it's pretty common that somebody might then think that the only care goals that are important would be to treat, stabilize, and maintain the person's health, and to focus simply on maintenance of the disease, and get wrapped up in a limiting or negative mindset when it comes to caring for somebody with dementia. Often that's because the person with dementia, the caregiver of the person with dementia, is grieving the loss of the person that they once knew, often at the risk of not being present to who that person is now. And when that happens, when you're regretting what this person has lost or where they have gone or where they think that person has gone, you're missing an opportunity for what I think of as an adventure and a blessing to re-engage with that individual and renew that relationship with who that person is right now. Interesting
way to look at that, Dawn, and that makes total sense that, the life is there, it's just a different life. And so why not build that relationship in that different way? Beautiful. What does person-centered dementia care mean, Dawn?
Okay. Person-centered dementia care, first of all, means checking at the door the assumption that with a dementia diagnosis, an individual with cognitive impairment no longer can make wise and sound choices for themselves, learn new things, be engaged, be happy, or enjoy life. An example of that was a video I looked at recently from the Alzheimer's Association website. It was a woman who apparently was an attorney. And the video was called Alzheimer's Stigma. And people were talking about the stigma attached to their diagnosis. And one woman told what happened when apparently she told her boss she had Alzheimer's. She was an attorney. And according to her, her boss said, I'm sorry, you shouldn't have told me that because now I have to let you go.
Wow.
Making an assumption that this person was not able to function or continue to function in any kind of a meaningful way. So when we talk about person-centered care, or what often is called person-directed care, it means looking at this individual with fresh eyes as someone with meaning and worth, someone who has unique needs and interests and who is still present and alive with a lot to contribute. What this should result when you get into both the care approach and the care environment is that you're paying attention to that individual's needs, wants, and desires and who they are. So, for example, if a person's living in a memory care residence, let's call this individual George.
Okay.
And the staff has a protocol that everybody gets a bath or a shower at 7 a.m. in the morning. And George has been consistently rebelling against that and making it difficult for them to give him a bath or shower at 7 o'clock in the morning. One option would be to label George in the notes as a resident who is uncooperative and resisting a bath. Or you could get curious and find out what's going on. And if you did, you might find out that George commonly had a bath just before dinner. And that's what made him comfortable.
Wow.
And what he was doing was not able to articulate that, but was definitely expressing a need and an anxiety. And there's always a need or an interest underneath that anxiety. And it means getting to that and learning how to treat the individual as a unique and caring individual.
Yeah. Wow. I mean, what a great conversation here, Dawn, because just, so many things that you've said make so much sense that I really never even thought about. Now, it does make sense that the way that you're caring and communicating with this individual is going to make a difference on how that disease is going to progress and how quickly, I would imagine, in minimizing and eliminating that stress that they're dealing with by just these examples that you're giving.
That's right. In addition to any medication intervention that seems appropriate, it's important to engage the individual in the moment of now.
Yeah.
I can remember in the early stages of my wife's diagnosis when she was still living at home, I would be sitting in my home office. I'd move my office to the house to be closer to her. And I could hear her crying in the other room. And I would talk to her. And she kind of wondered, what's the use of me continuing to go on with this illness? Because she knew by this point that this was essentially a terminal illness. So the key is to engage an individual in the present and help them be alive. They have a lot to offer.
Yes, yeah.
And they may be different, but different in a way that is still a good way. They're still alive.
Exactly. Well, we all know that for all of us, we need to be in the present. So why is it any different
that's exactly
with somebody that, yes. So has there been anything written about the research around a person-centered care approach?
There have been. One of my gurus, I'll admit, is Dr. Alan Power, who's a geriatrically certified physician. And he's written 2 seminal works on person-centered care and looking at a whole new approach to dementia caregiving. One of his books is Dementia Beyond Drugs, Changing the Culture of Care, and the other is Dementia Beyond Disease, Enhancing Well-Being. In Dementia Beyond Drugs, Dr. Power talks about an approach to dementia care that focuses on real-time, interpersonal, active, and positive engagement, which he describes as the experiential model as opposed to the biomedical or pharmacological model of treatment or care. The experiential model, according to Dr. Power, sees dementia as a shift in a person's perception of his or her world, and phrases that you might hear in conjunction with this kind of model of care would be, this individual is capable of learning, has a potential for life and growth, well-being, autonomy, problem-solving, and satisfaction of unmet needs. And in this model, drug use is rare, and individuals with dementia exist in a world that are populated by care partners and not just caregivers.
Yes.
In Dementia Beyond Disease, Dr. Power talks about the stigmatized view of dementia, namely that it renders the person incapable of making choices. And he further states, the ability to choose our life's path, to make decisions large and small, even to make choices that we know may not be in our best interest, is nonetheless a fundamental human right.
Yeah, definitely. So, Dawn, did you use this person-centered approach in your care with your wife, Nancy?
Not initially. I can remember a dinner in Portland, Oregon, in the early stages of her diagnosis. We were up there for a wedding. And I found myself at dinner completing her sentences, or maybe she would be pausing and fighting for words, and I would jump in.
Yeah.
And my sister, Irene, who was at that time a long-term care ombudsman, kind of figuratively kicked me under the table to prevent me from doing that and giving her the ability to make those decisions. Another example is we were at the Department of Licensing. She was no longer able to drive, and so we were getting an official Washington State ID. And there was a time when the clerk was asking her questions, and I found myself jumping in and answering them, and to the point where the clerk looked at me and said, "Sir, your wife needs to answer these questions for herself."
Yes.
And I had to step back and go, okay. The other example of this is when she still had legal competency, we updated all our estate planning documents. The thing I didn't do, as I look back on it now, is I didn't sit down with her and engage her in discussing her diet or end-of-life care or what quality of life means to her or what happens when she's no longer able to recognize me. Technically, and this would be an entirely different show, Tina, those kinds of quality of life conversations should occur when people are healthy and wise.
Of course, makes total sense.
But at the same time, I didn't get into that really in depth with her like I could have engaged her. But I was simply doing the best I could with what I knew then.
Of course. So I've got to wrap up the show, but I want you to a shout out or a call to action for anybody that's listening to the show that is dealing with this. What do they need to do?
Well, my best call to action would be that if you have a loved one who is diagnosed with dementia, that you make sure you support the engagement of a primary care provider who's trained in geriatrics. This individual can be a portal to person-centered and holistic approach to care by empowering the engagement of a team of professionals that can address not only the physical needs of the individual and medication and all that, which is important, but their entire being, emotional, psychological, social, or spiritual.
Yeah, great advice. And, going through this experience with my mother-in-law, they did have a team of everybody that all came in for 3 hours in all these different areas. So really getting that advice and belonging and finding out, it looks like you did a lot of research and to educate yourself on, the best way to care and help your wife, Nancy. And I would think that would be great advice as well, is just to really embrace and find out the best way to navigate through this different journey.
And look at the journey as a journey of opportunity.
Yes. Yeah, I love that. Don, thank you so much. It was a pleasure having you in studio and love to have you back.
I was happy to be here. Thank you very much for letting me be here.
You're welcome, Don. And this is your host and mortgage expert, Tina Mitchell, signing off for the day. Enjoy the rest of your Saturday. Enjoy the weekend. I'll be here, same time, same place, next weekend, right here on 1150 AM KKNW.